Dear ladies and gentlemen, thank you for joining us today and spending some time in the exciting world of Akrus Medical Technologies. Akrus is a German company and all of our products are being made in Germany. However, customers all over the world trust our quality. My name is Scott Kotwitz and I'm the CEO of Akrus. Today, I would like to show you the superior features and functions of our mobile surgical chair SC-5010-HS and SC-5010-HS. We offer two different models. The SC-5010-HS eye surgery model features a very low ingress level of 50 centimeters only. That makes it very popular with ophthalmologists. The low ingress level and the vertical footrest make it very easy and comfortable to elderly, small, handicapped and wheelchair patients to get in and out of the chair. Please note the protruding footrest while the leg support is being moved upwards. The SC-5010-HS hand surgery model travels from 64 centimeters ingress level to a maximum height of 100 centimeters. It's ideally suitable for any procedure in ENT, maxillofacial and oral surgery, implantology, plastic and aesthetic surgery, dermatology, and many other medical specialties. On our product familiarization tour, let's get started with the battery. All of our mobile surgical and examination chairs are driven by a very powerful 24-volt DC battery. Here's your battery and this is the recharger unit. Out of a fully charged battery, you would expect 30 to 35 procedures depending on your average weight of your patients. Once the battery is depleted down to approximately 20%, you will get a beeping warning sound if you hit any electric control button. Now remember, you still got 3 to 4 procedures in your current battery. However, with your next change of patient, it's also a good idea to change the battery. That will only take a few seconds. To remove the battery from the battery holder, just simply pull at the spring-loaded handle and pull the battery out of the holder. Use caution though, the battery is heavy. Use both hands, that avoids the battery dropping to the floor and causing some potential damage to it. To reinsert the battery, just simply set it up on the guides and push it in until you hear the audible click. The same holds true when you set up the battery on the recharger unit. Set up the battery on the rails and wait for the audible click. We do recommend to mount the battery to a wall in a vertical orientation. Gravity will help to press the electronic contacts firmly together so the recharging process will work properly. It will take approximately 4 hours to recharge the battery. You do not have to set a timer though to come back and pull it off. The electronic control unit will keep the battery between 95 and 98%. So the battery will not get overcharged and it will not get damaged. On this product, you will find the battery in this position. As I mentioned before, the chair is mobile. It is sitting on 4 heavy-duty dual casters. The casters and brakes are controlled by a brake lever on either side of the chair. With the brake lever being in a horizontal position, the chair moves freely into all directions and pivots on the spot and can be maneuvered even into tight corners. With the black arm of the chair being kicked down, the chair is firmly locked on the floor. Place your foot on the brake lever like so and firmly kick it down. With the green arm being kicked down, this wheel locks into the longitudinal position and provides directional control. Now you can turn the chair around tight corners. Now let's move on to the more specific features and functions of this chair. The chair offers 5 electric actuators, and they control the up and down movement of the headrest, the up and down movement of the chair, the movement of the backrest, the movement of the leg support, the movement of the seat tilt. A shock position of this chair is available. The actuators on the chair are controlled by a handheld remote control unit, or as an option by foot switchers or foot joysticks. There are several pairs of buttons on the handheld control unit driving the corresponding section of the chair. You may press 1 or 2 or more buttons at the same time to speed up the process of the movements. There are also several memory buttons available on the control unit. In order to save any position, just simply drive the chair to a desired position, then press the S button, and within 5 seconds the M1, 2 or 3 button at which you want to save that position. A beeping sound will indicate that this position has been properly memorized. To call a memorized position, just briefly press and let go the M button, and again within 5 seconds press the M1, 2 or 3 memory button, and the chair will drive to the memorized position. If you wish to change any memorized position, just follow the aforementioned steps at any time. Now we have covered the basics. In order to configure the surgical bed to exactly meet your special needs, let's have a look at the many versatile and useful accessories. We're offering different headrests to support and stabilize your patient's head in an ideal position during your procedures. A standard headrest, which is very popular with most ophthalmologists, but it's also good for all other procedures in the head area. A multi-articulated headrest, which allows, under sterile conditions, to reposition patient's head from a vertical to a sideways orientation. This allows the surgeon to maintain an upright posture, which takes all the strain off the spine during the procedure. Both headrests are also good for prone positions. A flat cushioned board. You might want to use a donut to stabilize your patient's head. We do offer a number of versatile and useful accessories, including but not limited to articulated arm for additional headrest tilt of approximately 30 degrees either way, standard armrests which extend the width of the backrest for bigger patients, multi-articulated armrests which can be set up at different angles to maximize patient's comfort and IV accessibility, safety railings on either side of the seat, foot switches, they control 2 actuators, foot joysticks, they control 5 actuators. Ladies and gentlemen, I hope this video has helped to show and demonstrate the functions and advanced features of our product. I thank you for your attention.